watching News 8.
With many children back in school, parents, of course, have lots of questions and concerns about COVID-19.
We spoke with the Rochester Regional Health pediatrician about when to call the doctor and much more.
The benefit that we have throughout the Finger Lakes region is that we're starting with a less than 1% prevalence rate of COVID. Again, the vast majority of tests that we've sent out at this point are negative. I have not had a positive myself personally.
Dr. Stephen Schulz serves on the Finger Lakes School Reopening Task Force. He says while he would never tell a family whether to choose remote or in-person learning, schools are doing all they can to ensure safety.
So, the highest risk of transmission and what's considered a close contact is a patient who has COVID being within 6 feet of another person unmasked for more than 15 minutes. So that is what is considered a close contact. The guidelines and our recommendation for best practice is that students remain masked and socially distanced whenever possible, especially indoors. They maintain the social distancing. Outdoors is a lower risk of transmission.
If your child is sick, Dr. Schulz says chances are it's not COVID.
Right now, because of community prevalence, there's a 99% chance that those symptoms are due to a different virus. The real thing that we're trying to get everybody to focus on with this is new, different, or worsening symptoms.
He says call your doctor if your child has a fever.
If a patient was positive for COVID, a student in a classroom, but everybody else in the classroom was consistent with wearing their masks at all times and maintaining their social distancing, there is not need for that class to, have any additional testing or to shut down.
Dr. Schulz also offered some reassuring news about how far doctors have come with treatments.
I think overall, especially in the adult world, that's where we're seeing the sickest patients and the folks struggling the most. I know that lots of advances in treatment have come out and improvements have been made. Out of the thousands of deaths in the United States, about 121, maybe we're up to around 150 now, have been in children.